Serious childhood illnesses, 0 to 3 years. When to call an ambulance for childhood illnesses. Drowsiness and unresponsiveness. It's normal for your child to be sleepy sometimes, for example, after a feed. But if your child seems sleepier than usual, this can be a sign of serious childhood illnesses. If you can't wake your child even when you try really hard many times, get help immediately. Unresponsiveness can be a sign of several serious childhood illnesses and conditions, including low blood sugar, hypoglycemia, or a life-threatening brain infection, meningitis. Difficulty breathing or unusual breathing. If your child is having difficulty breathing, you might notice that they have to breathe much harder to get air into their lungs. Have a persistent cough or wheeze. Breathe and the muscles between their ribs pull in. Can't make any conversation or sounds. In severe cases, your child might look very tired and blue. They might be quiet or make a grunting noise with each breath. These breathing symptoms might be caused by conditions like a chest infection, pneumonia, or severe asthma. Cold hands or feet, or pale, blotchy or blue skin. Cold hands or feet or pale, blotchy or blue skin might be caused by poor blood circulation or low levels of oxygen in the body, both of which can happen in serious childhood illnesses like bacterial infections or pneumonia. Seizures. If your child is having a seizure, their eyes might roll backwards. They might be unresponsive, shake violently in all limbs for a short time, and have shallow or unusual breathing. At this age, a seizure is most likely a febrile seizure. Febrile seizures aren't serious and sometimes happen when children have fevers. But occasionally seizures might be a sign of a serious brain infection. Rash, positive glass test. Skin spots or blotches that don't fade when you press a glass firmly against your child's skin can be an early sign of a life-threatening meningococcal infection. Fever, when to be concerned about serious illness. A fever is a temperature higher than 38 degrees Celsius. Most children with fever don't have a serious illness. But in some cases, a fever can be a sign of a more serious illness. If your child aged 0 to 3 months has a fever, seek immediate medical attention. For example, take your child to a GP or hospital emergency department. If your child of any age has a weak immune system and a fever, seek immediate medical attention. For example, take your child to your GP or a hospital emergency department. If your child aged over 3 months has a fever, take them to a GP if they look sicker than before, for example, more pale, lethargic or weak. Are having trouble breathing. Are drowsy. Seem mildly dehydrated, are refusing to drink or are weeing less often. Have a stiff neck or a mild headache or light hurts their eyes. Vomit or have diarrhea. Have a rash. Have mild pain or discomfort that doesn't get better with pain medicine. Also, your child aged over 3 months should see a GP if they have a fever that lasts more than 2 days. Seem to be getting sicker. Have a febrile seizure. Just don't seem well and you're worried.